Welcome to Conversations with Fr Bosco, a webinar series hosted by the Office of Mission and Ministry and the Georgetown University Alumni Association. Thank you for taking time out of your day to join us for this session, Ignatian Ethics in Healthcare with Fr Myles Sheehan. Our host, Fr Mark Bosco, is Vice President for Mission and Ministry at Georgetown University and holds an appointment in the Department of English. A native of St. Louis, Missouri, Fr Bosco joined Georgetown in 2017 after 14 years at Loyola University Chicago, where he was a tenured faculty member and served as director of the Hank Center for the Catholic Intellectual Heritage. As a scholar, Fr Bosco has focused much of his work on the intersection of theology and art, specifically the British and American Catholic literary tradition. He has published on a number of authors, including the writers Greene and Flannery O'Connor, and is the co-director and co-producer of the feature-length documentary on Flannery O'Connor. This award-winning film will have its television premiere on PBS American Masters on March 23rd. I'm Kelly Young, Associate Director of Strategic Engagement in Alumni Relations, and I'll be facilitating today's webinar. As a quick reminder, today's session is being recorded and the recording will be shared via our follow-up email. You may also use the questions section of your webinar control panel to submit questions for Fr Bosco and Fr Sheehan. Without any further ado, I'm pleased to turn things over to Fr Mark Bosco.
Thank you, Kelly. Thank you so much. It's good to be back in these conversations. And today we have Fr Myles Sheehan. It's good to have you here at Georgetown, Myles. You come as the director of the Pellegrino Center for Clinical Bioethics. And you came also just as COVID-19 was taking over our lives. So I know it's been quite a transition, but we're still very excited to have you as part of our Georgetown community. I'll kind of let you introduce yourself by making a quote that I've often heard said about me and other Jesuits, that we live hyphenated lives in some ways. We're both priests and members of the society, but we also have other jobs. Yours is priest and physician. And I know I first met you when we were both out at Loyola University Chicago. You were dean of the medical school there at that time. So could you maybe just tell us a little bit about yourself and your vocation, what led you to medicine, what led you to the Society of Jesus?
Thanks, Mark. I appreciate the invitation to be with you today. Just a little clarification. I was the senior associate dean at Loyola Chicago at the medical school, and I am a physician, but I have an inactive license now. But let me answer your question a bit better than that. Grew up south of Boston, a town called Marshfield. Went to college and medical school at Dartmouth. Met the assistant chaplain. He came when I was a junior, a guy by the name of Joe Devlin, who was a New England province Jesuit, who really influenced my life in very positive ways, and I think got me to begin to think of God and particularly Jesus as a friend, and worked through some of the little bit of the scary stuff you sometimes find, particularly if you're Irish Catholic, dealing with God. And Joe was a wonderful influence. I was interested in society, but I was also very interested in medicine. I went down and met with the Jesuit vocation director in Boston. He said, "Do you want to be a doctor?" And I said, "Yeah." I said, "Then go be a really good doctor. And if God wants you to be a priest, he'll bug you again." And in fact, that happened during my residency in internal medicine. So I finished my residency in internal medicine, took my board, so I'm all cooked in that. Went on to the novitiate in 85, took vows 87, had my first fling out at Loyola Chicago from 87 to 89, where I got a master's in philosophy with an emphasis in healthcare ethics. And I can't tell you how exciting that was. After years of working in the sciences, I mean, there were a lot of distributives and I had read broadly, but it was just a different way to think. And I think coming from some years of medical practice, and again, a scientific background, it really opened my mind as a different way to see the world. I enjoyed it a lot. I asked and got permission for what is the Regency period during our training, when often folks will teach in a high school, to get further training in geriatrics. And so I worked with the Division on Aging at Harvard Medical School from, where are we now, years 89 to 91. And then I went to do theology at what was then called Weston School of Theology, now the School of Theology and Ministry at Boston College. And I was able to work at Harvard Medical School and as an attending at Boston's Beth Israel Hospital. So I was really fortunate to combine my theology studies with an active practice of medicine so I could keep up. You know, people often ask why geriatrics. There were several reasons. One is I like old people. Except as I get older, I'm finding that changing. But you know, my folks were a little bit older when I was born. My dad was 43, my mom was 40. And when I began practicing, I found caring for older patients was often fulfilling. I think in terms of the society's call at that time, and which continues, is about faith that does justice. I was struck that we don't often take good care of our older people, that they're underserved in terms of people who know geriatric medicine, and that there are a number of things that affect older persons that we should do better with, both in medicine and as a society. And so I was happy to be involved with that. Went out to Chicago in 1995, and in the course of human events became the senior associate dean for the medical school there. Really had just a wonderful time because the senior associate dean is in charge of undergraduate medical education. And so I got to do a lot of curricular work, really got to know the students. I've done well over 100 weddings for my students. There are 3 little boys called Myles because of the weddings and other things I did. So it was just a wonderful, affirming time. The business about the hyphen between priest and a Jesuit and physician, I think over time it didn't occur to me anymore. And I think it was partly working with so many colleagues in the medical center because they are wife and physician, dad and physician, you know, etc. And so there are parts of who you are that will be expressed in different ways at different times. But I was lucky and formation worked so that I was able to view who I am as a unity and be very happy about that.
That's great.
Then everything went to hell. I became the provincial. And so to be this.
Yeah, we can talk about that in a second. That's because I like to spend some time with that, especially as the provinces become bigger. But I do think it's really interesting, though, this idea that certainly that hyphenated thing. We do ultimately, as we grow older in the Society of Jesus, I think Jesuits understand it all. It's all of a piece. It's not separated. But I remember when you were being missioned back to Georgetown University, the guys in the house were saying, you know, as you know, we're a house of PhDs anyway, so we think of ourselves as doctors, but someone said, oh, we're going to have a real doctor in the house. We can say that now, a real doctor. So, but you know, the Jesuits run 4 hospitals, medical schools, and Georgetown, of course, is one of the, I guess, probably the earliest and premier one in that regard. And I remember when I first got here, Father Jim Duffy was still with us in the medical school. I think he's at St. Louis now, if I've got that correct. So why do you think it's important apostolic work for the Jesuits? Medicine itself being the MD. What are some of the great things that have happened, or ways that you could argue this is a really good, important apostolate for us?
I mean, let me talk about my time at Harvard first, because I found people were really nice to me and fine, but I didn't get to express myself in terms of my religious ideals. And it wasn't that I was suppressed, it just wasn't an opening. And there were times that despite how good people were to me, I felt a little bit like I was an object in the zoo. It was like, and now we have a Jesuit priest who's a doctor. And so at Loyola, and I hope here once this silly pandemic ends, that at Loyola I got to, you know, say mass with the students, spend a lot of time talking with them, do informal counseling. Be with them as they work their way through medical school, and then get to know my colleagues in the faculty and the doctors and the rest of the clinicians at the hospital and become informed in their lives. And I think it was a two-way street. First, you know, I think they were surprised to see that someone was a Jesuit and a priest and who, you know, was a good doctor and was a colleague. I also, I think brought to the society a sense of what goes on in hospitals. I mean, the hardest part about being a Jesuit doctor is nobody knows what you're doing when you come home. And people have very strange ideas about what it means to be a physician and the amount of work that it requires. The thing that for a larger part is I really think that for the church's teaching in areas of healthcare ethics, it really needs to have people who are involved with the healthcare, or we run the risk of saying things that are not grounded in clinical reality.
Right.
And thus can sometimes miss the mark on a teaching. So it's a two-way street. I think, thanks to God, I'm able to bring something to the hospital as a Jesuit to witness that, you know, God is present in the hospital in ways that are different, but no less real than in a church. And also to be able to bring the experience I have of being with my colleagues, caring for patients, back to theological reflection, and in my work with ethics, to be able to work with and for the church to understand what are some of the challenges we face today.
Myles, how many, I don't know this answer. Do you know how many, do you guys meet, how many Jesuit doctors, MDs, are there in the United States right now? There's got to be at least a half a dozen, if not more.
Oh, it's more than that. It's somewhere between 20 and 30. I don't have the exact number. Not all of them are actively practicing. And I mean, I don't actively practice clinical medicine anymore, but I'm active in the hospital.
Right.
And so, yeah, we have some doctors who are family medicine. We have many doctors who do internal medicine. We have a psychiatrist. I'm not sure what else. Some of the specialties like surgery are very hard to do simply because with our training, you can't take time off really while you're training in surgery and be able to go back safely. Yeah. So that's something we can't do well.
Cool. Yeah, that's great. So we kind of mentioned, Myles, that you were called away from medicine by the Society of Jesus to be the provincial of the then New England province, which is now, of course, part of the East Coast province, which is also, of course, including Georgetown. That had to have been quite a change in apostolic mission, right? And I wonder if you can just maybe tell folks about what it meant to be provincial. I once heard it said by another Jesuit provincial that it's like being a conductor of a symphony in which all the members of the orchestra think they're the first violinists. So how do you make harmony with a lot of very talented, bright guys who all have a piece of their mind to tell you?
The provincial, just for folks who don't know, is the head of the society in a geographic area. So there were roughly 300 Jesuits in the New England province when I started in 2009. I think one of the things that surprised me was the carryover skill that I had with listening to people from being a physician. And so really, there are two central things that are interlaced. The provincial's responsible for the apostolic work of the province, and so keeping an eye on what's going in our institutions, looking towards the future, making sure stuff is okay financially and all that rest. But the other part is what we call cura personalis, the care of the members of the society. And one cannot make apostolic decisions about individual Jesuits without getting to know them as a person. And so a central part of the role of the provincial is to meet with every Jesuit once a year for what's called the account of conscience or manifestation, where the Jesuit says, this is what's going on with my life and with God. And you gain a good sense of people with that. I found most people were very generous. I viewed with people who are hardworking that the most important thing I could do was to be kind and to be encouraging. Are there some people who back in the New England province don't think I was kind or encouraging? I'm sure. But on the whole, I tried to be that way. And to do that, to encourage them in their vocation and also to let them know how much they were appreciated or are appreciated for what they do. Probably there were several big things. I mean, I was the last provincial in New England province, not because of my incompetence, but because that was part of the plan. So we originally joined with then New York province to form the short-lived USA Northeast, which in July of this past year merged with Maryland to become USA East. So that was one part of what I worked on quite a bit. Other things that I thought were really important, along with the care of the individual Jesuits, was to work very hard on how we safeguarded children and to make sure that we owned up to the sins of the past. And that was really painful, because I think living out in Chicago, I thought it was done and fixed, and nope. And there were no new problems when I was provincial, but there was old stuff and deep wounds that needed to be healed in a variety of ways. I'm sure they're not healed, but I did the best I could with that. And then the final thing was, because I think our apostolate of the spiritual exercises is crucial. We have a beautiful, beautiful retreat house in Gloucester on the water, part of Gloucester, called Eastern Point. And the building was very old and was falling down. And so thankfully we were able to put up a new building, keep that ministry going. And although with COVID it's been a little slow, I think we can look forward to a future where folks who want to have 8 days, or if they can take the time, 30 days doing the spiritual exercises, it's a remarkable place, with the North Atlantic crashing about 600 yards away from where you are. So.
Yeah, wow. I was up there, I guess it was before the renovations, yeah, a long time ago, early as a Jesuit, but a beautiful spot right there by the water. Wow.
Yeah, the main building, the dormitory building, had been built as a retreat house for high school kids, and so that got a little old after 60 years.
So let's talk about Georgetown Medical and the Medical Center. What should our viewers know about the work of the Pellegrino Center for Clinical Bioethics and your position as its new director and also the Loyola Chair of Catholic Healthcare Ethics? So can you give them a history of the Pellegrino Center and its importance for research and practice?
Yeah, the Pellegrino Center actually was founded 30 years ago, initially known as the Center for Clinical Bioethics, operating out of what was then the medical school medical center as part of Georgetown. And its founder, Dr. Edmund Pellegrino, is really probably one of the founders of bioethics in the United States. He was a clinician himself, as well as a scholar, very versed in the classics and with a classical education. And so he brought philosophy to the practice of medicine and looked particularly at the doctor-patient relationship. He had a big co-worker, David Thomasma, who I knew out at Loyola Chicago, and they published many really seminal books, Philosophy as Medicine, the Virtues of Medical Practice, Christian Virtues. And what Dr. Pellegrino, said at the heart of medical ethics is the clinician-patient relationship, where the clinician attempts to provide the right healing action for the person, looking at the lowest level, what's the biomedical good? That's the instrument. But the important thing is to allow the patient to describe her or his own personal good, his or her good as a human being, and his or her own spiritual goods. And that together as a team, the clinician and patient work to try and achieve those goals to the extent possible, depending upon the illness. Dr. Pellegrino was a strong proponent of professionalism in medicine, was extremely negative about some of the trends in terms of managed care and increasing commercialization and for-profit medicine. Also was very farsighted in looking at the influences of religion, society, race, in terms of where that doctor-patient relationship is located. After Dr. Pellegrino, there have been a couple other directors, Dr. Carol Taylor, who's still with us as a wonderful person at the nursing school, and then Dr. Kevin Donovan, who was the director for approximately 10 years and stepped down as director the end of this fall to allow me to come on in. What we do is, I think we are the practice of clinical bioethics. So yes, we write, we research, but we also have a busy ethics consult service at MedStar Georgetown Hospital, where we work with clinicians, patients, families on issues, not necessarily big conflicts, but often how to proceed and to try to find the best way possible for the right healing action in a variety of clinical situations. We also do a lot of medical student teaching, resident teaching, as well as have outreach through some of the works that the Pellegrino Center does.
Yeah, that's wonderful. I've always thought that I come from a family of nurses. My mother's a nurse, my aunts were nurses, I have sisters who are physical therapists and things like that. But there is a spirituality to healthcare. I mean, it's a vocation that really engages the soul in a really profound way. Not that other vocations don't, but you know, when you're there with people who are ill, people who are really afraid, people who are broken or harmed by stuff, by a disease even, it really does ask you to kind of take care of the soul as much as the body.
I mean, and that's why you asked earlier about, you know, being a Jesuit physician. I found over time, I certainly behave in different ways in different settings. But I found what was happening in my heart was often quite similar. Sure, did I use medical knowledge when I'm in the hospital, and, you know, I didn't do medical stuff when I'm talking to someone in the confessional or somebody for counseling or those kinds of things. But I did find that my heart had been touched by people who were in pain before me, and that my desire was to try to heal that as much as possible. But over time, I realized I wasn't the one who could do the healing. And that's where I find both being a priest and a doctor is a spiritual experience.
Wow, that's wonderful. You know, a lot of our viewers know about the Kennedy Institute of Ethics too. Do you collaborate with them? How are you like them? How are they different from you? And who are some of your collaborators?
I mean, the Pellegrino Center really came off as an offshoot from the Kennedy Institute of Ethics. They're having their 50th anniversary this year, and Dr. Pellegrino was an early director of the Kennedy Institute. What the Kennedy Institute became is perhaps more of a center for the philosophical study and intellectual research in bioethics as well as other areas of ethics. And the Pellegrino Center became more of a center for the practice of ethics. One of the things that I'm excited about and would like your viewers to know is that under the leadership of Dr. DeGioia and our provost and the leader of the medical center, Dr. Healton, we're looking at this emergent ethics network as a major push over the next few years. We've established a Center for Environmental Justice, a Jesuit from, I guess he's actually Swiss, but French Jesuit, Gaël Giraud. He's here, and there's hopes that we'll have a Center for Data and Ethics, which is important in a variety of ways under the scenes, and that these four centers can both work on their own stuff, but that the opportunities for synergy, first on the campus, then nationally and internationally, we expect could be very important. And so some of the issues we look at in bioethics, for instance, what happens with your medical record? Well, that's a big part of what goes on in data ethics. There's tremendous promise in using de-identified samples of large numbers of people who have been patients, but there are ethical issues that come with that. When we look at the environment, healthcare has a big footprint on the environment. If you look at our hospitals, well, obviously they're lit up, they're heated, they're air conditioned, they use a whole bunch of water 24 hours a day. Are there ways in which we can lessen that footprint and think about both more environmentally sustainable construction? And also to realize, again, a larger thing, you know, we're going to have the Pellegrino Symposium, which is a yearly conference this year by Zoom, and the title this year is This Moment in Bioethics. As we look at this moment after this past year with the COVID epidemic, with the racial injustice that became so horribly clear over the past year, with the issues of the environment, to look at how we center the doctor-patient, clinician-patient relationship within the broader issues that affect that. So, you know, race is obviously a big one when you look at the big disparities in healthcare based on race and socioeconomic status. The environmental impact, you know, many areas and cities are sort of these special heat islands. And again, that affects people's health in a number of bad ways. I talked about the issues of data. So, you know, these are the things that we look at the Pellegrino Center, and I'm excited about the Emergent Ethics Network, the ability to look at the broader issues that have a profound but not often noticed impact on the doctor-patient, clinician-patient relationship.
Wow, that's fantastic. You know, there's a sense that, you know, I guess the question I have is, and it's really kind of embodied in your life, Myles, as a Jesuit doctor. But what are the words of Ignatian spirituality? How does Ignatian spirituality fit into the life or in terms of how we talk about healthcare, how we talk about you know, illness and things like that? Is there any possible way you could think just about? We always talk about the lights and the shadows in our work as Jesuits, and also as with our lay community, our colleagues. Is there anything you would want to just highlight, just that has been part of that spiritual exercise or Ignatian spirituality has been just something very profoundly helpful and important aspect of the day, of the moment?
You know, the man who recruited me to Loyola, Ralph Leichner, and he died in '99 and early 2000. I succeeded him as the senior associate dean. And when they were building the new medical center there, he said, "What's the thing at the end of Matthew's gospel about you're sick and you cared for me?" And I said, "No, you're ill and cared for me." And they have this in the atrium of the school. And I often thought and tried to impress on my students that depending on your tradition, but to think about you're caring for Christ, you're caring for Jesus. So that idea that finding God in all things is in some ways very easy at the bedside. The challenge, sometimes the shadow, is that sometimes patients aren't nice. Sometimes patients are really difficult and nasty, or they've done terrible things. Or I can remember a situation where I came in one morning to find a newly admitted patient who had been transferred from the prison, and he had been very violent. He tried to attack a nurse the night before. They had a guard there. He was chained to the bed. And one of the residents would snicker when I'd say, "Come on, behave. This patient's made in the image and likeness of God." And so he said, "Is this the image and likeness of God?" I said, "Yeah, it's got a little tarnish on it right now." But again, it's important that you see that even in front of a person who at that moment was not exactly a perfect icon of our Lord.
Yeah, right.
And I think the other part, just really practically, Mark, the examine, you know, for those people, I imagine most of your viewers have it, but this is the day with God. It's 10 to 15 minutes where you put yourself in God's presence, are grateful, think about what's happened, think about the lights and shadows for that, and then, you know, thank God for what went well, ask for God's help for what didn't, and then look to tomorrow. That's really a powerful way to allow us to contemplate the presence of God in all things, and to just realize how many encounters we have during the day, and that the Ignatian spirituality allows you to see the whole world as a sacred space. And again, our churches, our chapels, they're sacred spaces, but they're not the only ones.
Yeah. It's beautifully said. I do think that I was talking to somebody once about what is grace, and it was somebody in the medical profession, and they were actually from a Protestant tradition, but they kept on looking to Ephesians, talking about what grace is there, and he says, "How do you understand grace?" I said, "Well, I think grace is a revelation." That God is a revelation, an epiphany of moments. And I said, that means that God was going to come in mysterious places, right? When we least expect it. And it could be with a very difficult patient. It could be with a very difficult Hoya student. It could be with a very difficult parent. It could be with any kind of, that somehow having the eyes and the ears, the sensitivity to sense God's working is in many ways a work of grace. I think we do it as professors, as teachers, but again, as doctors, and modeling that at Georgetown Medical is such an important part of this.
And I think the part that also, you know, with our students, our medical students, we have such high ideals, and appropriately so, and we need to maintain that. But what I find is sort of just a wonderful moment was when someone falls short a little bit. You know, I don't mean that they do anything drastically bad, but maybe they get exasperated with the patient and walk off, or maybe there's something going on, and you can just sort of say, what's going on? Let's talk about what's going on and who's the person you want to be. And okay, you made a mistake. What do you got to learn from there?
Yeah.
And those are the wonderful moments, because I know that's sort of the way God acts with me, because I've certainly messed up, you know?
Yeah, yeah. I'm really glad that we'll be having Father Jim Shea join the medical school, medical center, so that he can accompany our med students and faculty and staff, actually, be a colleague of yours as well over there, just to kind of and draw that out of them, for them to accept the fact that, you know, we're all kind of imperfections, made perfect by God, made perfect by our desires for God and to do good. So that's going to be a nice little pivot for the hospital and the medical school. Speaking of great examples, you held the John Collins Harvey lecture this past February with Dr. Anthony Fauci, who everybody knows went to Regis High, went to Holy Cross, very much a man in the news and a great man. I was just wondering if, from just listening to the video of it, I had to miss some of the actual moment. But what were some of your takeaways about the man Fauci and his dedication to medicine and public health?
One little thing that was a surprise is I didn't know he was married at Dahlgren Chapel, and so that he and his wife, Dr. Christine Grady, who was one of Dr. Pellegrino's graduate students, were married here. So everything is less than 6 degrees in separation, it appears. I think the part that struck me the most was when we got away from talking about COVID all the time, which I didn't want to do. This was not a COVID interview. What I wanted to do was to find out more about who he was. And I was struck by how influenced he was by his classical education. And as he said, studying the classics and the way he did pre-med at Holy Cross, it was pre-med and classics. He found that he encountered in the Iliad such an exposure to humanity that in many ways it prepared him for the characters he met as a physician, as well as some of the characters he's met in his life as a public servant. And so that profound encounter with, ancient literature had a lasting impact that makes him part of who you see today. The other part was, just listening to him talk, and that he is a very driven man in a good sense. He's driven to do the good. He talked about how difficult this past year has been in terms of really not having much time for anything other than dealing with the public health emergency. And the other thing is, I think that came out is his competitiveness. Since I asked him how at 5'7" he was the captain of the high school basketball team at Regis, he goes, because I was good. I was really fast. And if folks want to see that, if you go on the Pellegrino Center website, so the Pellegrino Center for Clinical Bioethics, there's a link where you can see the recording if you're in the mood for it.
Yeah, he's been so important as a kind of a real anchor for us as we've gone through this pandemic. And this pandemic has overwhelmed our hospitals and our healthcare clinicians, the fatigue that is going on, people doing such great work under such pressure. What do you see as the most important issues that we need to carry with us in the future? Like, it would be a shame if we didn't capitalize on, on this year in terms of healthcare, in terms of the pandemic. What do you see on the other side of the pandemic that you think really we have to deal with, and most importantly, try to improve upon?
Well, there's one basic attitude. I started my training when AIDS hit. And so I was a resident in Boston when my second year of medical training, we began to have a large number of people infected with HIV. And I think after, being all trained at medical school, and I'm at a Harvard teaching hospital, and I think how smart I am, just how abysmally ignorant we can still be, and that there's so much we need to know. So I think first, as we go forward, I expect that the clinicians trained during these days will have a sense of humility that they'll carry forward. I think part of that is to realize that when you initially didn't have effective treatments and so many people died, it made you realize how important it is for you as a clinician to sometimes be the only therapy that was available to try to comfort, to care. I mean, certainly that's something that nurses do all the time. I think when physicians can't cure, it's something that they have to discover within themselves, or they don't be good physicians. Larger things, I really hope we pay attention that the public health network in this country fell apart, and it's been falling apart for years. We need to pay attention not only to the possibility of other pandemics, but to look at public health as a greater priority. So even outside of the field of infectious disease, to look at the sociologic determinants of health. For instance, you know, if you look at zip codes in certain metropolitan areas, in one area, in one zip code, people will live in their 80s, and the next they'll die in their 50s. These are things that we need to be addressed, you know, systematically and systemically. So a number of different lessons. I think the other thing is, you know, I don't view science as a god. I view it as something that's part of reason. And I've found the last year really difficult with what I perceive as an irrationality among so many folks. You know, Mark, there are many people who think you and I are irrational, that we believe that the Son of God became human and rose from the dead 3 days after he died. But I think there are ways in which faith and reason can combine to have both religious faith, but even outside the issue of religious faith, there are a number of people who have fixed illogical thoughts. And I think it's partly out of a fear that the world is changing, and that to develop some sort of a shell that keeps you safe. I mean, we see this in people with religious delusions, that they put up there as a way to hold on and secure them against something else that they find more frightening. I hope that we're able to not make science a god, that it knows the answer to every question. It doesn't, and no responsible scientist would say that. But we really do need to be able to pay attention that when someone says there's a lethal new illness coming out, that people don't say it's a hoax.
Yeah. Wow. Yeah, I do think you're right. And this crisis has. You hear some people say on one level, well, this is the equalizer. It might be the equalizer in getting infected, but in terms of death, and in terms of populations, it's not an equalizer at all, right? It has been people of color and people who are poor, and the people who are actually have been working during this COVID to keep others safe, you know, that have really bore the brunt of this disease, and I do think that that's, you know, just knowing that Father Gael's here, who was in our last conversation actually, and others, and I know that that's a big place for us to be as Jesuit institutions now in healthcare and healthcare studies and public policy around healthcare. We're doing that even now at Georgetown, right? By creating health sciences and the nursing, kind of having there are two synergies there, as opposed to kind of just always in one combined place. So I think this is a really an interesting moment, and it's almost, it seems to me, Myles, that what the COVID has done for us is it's almost given us permission to think big, ask the big questions again, in a way that we wouldn't be shut up or, you know, or pushed to the side because we're still dealing with this. I don't know. Is that your sense of things?
It certainly jolted us out of the trajectory that we thought we were merrily going along before, and has left us with a sense of our own fragility. I think we had some Promethean senses about how we could do everything. And here's this stupid little virus that's come and killed over 500,000 Americans over the last year. That should shake us out of our complacency and make us recognize that we live in an interconnected world, that there are threats to our existence, that we're not going to be able to do that individually, that it requires solidarity among groups, as well as individual responsibility.
Yeah, amen, amen. Maybe bringing it right back to Georgetown's Medical Center, and you know, I know it's been hard. You said you've not really gone out to the office because of COVID and things like that, and you're like all of us, you're working from home for the community. But it's somebody relatively new though to the Georgetown's Medical Center. What do you see? What stands out in terms of our Catholic and Jesuit values Can you name or just describe what you've seen or heard or sensed?
You know, the places where I've had the most contact with people has been in the hospital. And I have been first really touched by how kind people are to me, because the hospital is a maze and I'm always walking into the closet and can't find my way around. And then but probably more substantial is there really is a concern for us to continue the Catholic identity of the health system, the health center, to not simply make sure, although that's an important thing, that the ethical and religious directives are followed, but a real desire to say, well, what does this mean? How do we approach patients? How do we look? Is there a way in which we need to pay more attention to how we continue the healing ministry of Jesus Christ? So I find great attention and concern and respect. There's also a lot, and you know, the phrase cura personalis is used a lot. Like anything that is used a lot, it can be a slogan, but I don't find it simply that. I really do find with my interactions in the hospital that there really are great efforts to care personally. Likewise, at the medical school, again, I wish I could spend time with medical students, but working with folks in the dean's office who, you know, work with and implement the curriculum, they're tremendous concern for how the students learn, for their ability to have time to find balance in their lives, and to address that again in a very difficult year this year. Can you imagine the stresses of medical school and then you can't be with other people? I mean, one of the most important ways to study in medical school is in a group, and it's been very hard for these students. And I've been impressed that there have been real care shown to the individuals who were trying to learn during a really difficult time.
Yeah, wow. Well, thanks. I feel like we're at a grace moment though, with having you be part of Georgetown with Father Jim Shea, the ability to give maybe medical retreats for M1s, M2s, M3s. And I'm just really grateful that you're connected to the hospital and to so many folks over there. So there'll be some questions coming, I think are coming up just now, but before we go to the questions, just one last question was, students and our viewers always love to know, what are Jesuits reading right now? So can you share some recommendations of what you read, whether it's professional, but a layperson can understand it, or just in terms of your hobbies? What kind of?
Well, for work right now, I'm reading The Virtues in Medical Practice by Dr. Pellegrino and Dave Thomas. I have it here. It's not showing up very well. And it's a dense book, but it's a good book, and it allows us to understand again how we think about what human excellence means in the context of a particular profession. Spiritually, I'm reading a book on my Kindle, and I have to look up the author's name. It's called The Way of the Disciple by a man, Erasmo Oliva Marikakis.
Oh, wow, yes, I know him. He's a Trappist. He used to be at US. Yeah. Great von Balthasar scholar.
Yeah, and The Way of the Disciple is a short book, pretty good for Lent. It's on Kindle. So you don't have to spend an arm and a leg for it. Again, it's not a superficial book, but it's really enjoyable. Another book that I've been recommending is Timothy Radcliffe's Alive in God, Christian Imagination, a different way to perhaps remain completely faithful to the tradition, but to express it in different ways. And finally, the truth is, when you said, you know, what are you reading? I read a lot of stuff that is perhaps not exactly serious. So I like to read science fiction. So I've been reading this series called The Endarian Prophecy by Richard Phillips. So we're around volume 5, and I'm hoping I like the series, but I hope I don't have to go through 15 more volumes or something like that, but it's enjoyable. And I have a mystery that I'm teeing up maybe for this weekend. There's a woman, Ellie Griffiths, English woman, who is quite a good writer, and it's a book called Strange Diaries about how a murder mystery writer gets involved in murder herself.
Wow. Wow, very good, very good. Well, let's go. There's some questions here. Father Myles is a physician and an ethicist. Can you share your thoughts on the current moment in the pandemic, the issues some cities, states, and countries our experience with the slow rollout of COVID vaccines and limited vaccine supplies and the inequities in distribution. So a little bit what we talked about, maybe focused on the inequities between cities, states, and all that kind of stuff.
I mean, first off, I realize there has been slowness, but when you think of the vaccine was developed 3 months ago, and we've already had over 100 million doses given in the United States, a country of 330 million, that's not bad when you think about the scope of the problem and just the logistical stuff. I don't know enough about logistics to talk about how, why, city, state, or what's going on right now within this country. I think an important thing we need to think of in the United States is it appears that we're going to have a surplus of vaccines, and to make sure that we share those with the rest of the world, and to be very intentional in the best sense that we obviously need to, it's totally appropriate that we look after our own country, but that we don't simply sit on it or sell it at high prices, that we really look to those places that need it the most. With the different kinds of vaccine, as you know, in the United States, there are 3 different vaccines available now: the Pfizer, the Moderna, and then the Johnson & Johnson. The Johnson & Johnson one, I think, is going to be being produced in bigger numbers. It's only 1 shot. That should probably help more people to get it. Finding locations, part of the initial problem with the Pfizer and Moderna with their cold storage requirements, so that led to some inequities with folks not able to get to like medical centers or places where they could be given. I'm hoping that that will be decreased. With some of the things in other parts of the world, I'm not entirely sure what's going on now in Europe with the AstraZeneca Oxford vaccine has not been approved in this country, but it's the major vaccine that's been used in the United Kingdom. However, a number of the countries in the European Union have put it on hold because of instances of blood clots. And I'm confused because by my reading, it looks as if the instances of blood clots are no different than people who don't have vaccine, but there have been some temporal associations. So there are a lot of problems along the way. I think that there is a need to move quickly to vaccinate as many as is possible so that the variants will not continue to develop and cause the possibility of in a bad way, a vaccine breakthrough or a viral breakthrough against the vaccine. So far, I've seen stuff that the Pfizer vaccine is effective against all the variants. My presumption would be the Moderna would be as well, because they're pretty similar.
Yeah, we have a question about those who are hesitant to take the vaccine. How would you address that issue, especially if they name it on religious grounds? I mean, I know that the Jesuit community has gotten the vaccines. We have many men over 65, and we've all done it. But there is a hesitancy. People who are out, I'm not going to say vaccine deniers, but there's definitely hesitancy. What would you say to them? What would be your pastoral counsel for that?
I mean, at first I'd say, why? Can you tell me why you're hesitant? And try to answer that particular question. I know there has been some concern because of how the viruses were produced. The Pfizer and the Moderna viruses were not produced using any cells from an abortion. They were, after they were produced, tested on some cells from an aborted cell line. I believe that the Johnson & Johnson and the AstraZeneca have a little bit more of a direct relationship in that the virus was produced, I believe, using cells from an aborted cell line. You know, there's a long tradition in the church of what do you do in a complicated world where you cannot keep yourself completely free of evil, and it's called cooperation. Now, the vaccines, particularly the Moderna and the Pfizer, I can't really see anything to object to in the sense of taking those vaccines because they were produced without any problem. The testing is very remote from the individual. The individual who takes the vaccine in no way is cooperating formally or materially with the vaccine. So, I mean, I took it without a moral qualm. The other vaccines that, again, I wish that they could have come up with a different way of development, but the time when the abortion occurred that led to the creation of these cell lines in which the vaccines are developed is years ago. So it's remote in time and space. And
I heard, yeah.
So, I mean, there's some way it's like, did we learn things from making the atomic bomb that we use now in ways that are not associated with bomb making? Yeah. Is there a very remote cooperation with something that was evil? Yeah. But it's really long ago and far away and has nothing to do with our using it at this time.
Yeah, that's a good analogy. I appreciate that a lot.
And I mean, I would say that I think that the other part about taking the vaccine is not only are you taking it to protect your own health, you are taking it to protect the health of others. And so I would not be anything other than respectful for people who disagreed. But I do think that the charitable obligation is something that should go into their moral calculus.
Yeah. I do know somebody who's very hesitant to take it. And it is on some of the religious grounds, but I also just, this young woman has a family, and you don't want her. How can you be morally responsible for those around you? So it's a real good question. We have another alum who asks, can you give examples of ways you and your team guide medical students and staff and faculty on strengthening their spiritual lives, especially do you use the term contemplation and action as an approach? Obviously, we've talked about the Ignatian examen already as a wonderful tool. What kind of tools have you used? What kind of avenues of engagement have you used to kind of engage the spiritual life of healthcare physicians and nurses?
I mean, particularly at Loyola, and because of the pandemic, I haven't had the ability to really be in contact with folks during the past year. But we did have retreats, we had specific conferences, we would try and have dinners where these things could be talked about. I would bring these issues up. We had a session at Loyola where all the first-year students had to go and spend 4 hours rounding with a chaplain in the hospital to learn that what the chaplain does isn't just say prayers, although that's a great thing, but there's a way in which they look at the needs beneath the need and to see what goes on beyond the exclusively biomedical story. And likewise, to do that with our physicians, to be available to hear their stories and to provide them either a safe outlet in an individual setting or in a group outlet to talk about the challenges and the great opportunities it is to live a faithful life as a Christian in the healthcare community.
Yeah, I like that idea of having the residents, kind of shadow the chaplains. We have a great chaplains program, pastoral care program in the hospital, and really
it's like choke myself with my collar. Excuse me.
A little bit more, yeah.
Still cockeyed.
But I do think that's a really good thing. I'm profoundly moved by how the chaplains at Georgetown MedStar have really been, present to those, especially the family members where they can't go in to see their loved ones because of COVID, and their real desire to be with people at this moment. I think hopefully we can bring that into our training of medical students as well. Could you, apparently, I didn't know this, but can you share a bit more, Father Myles, about the class you are currently teaching at Georgetown's Med School? Are you teaching a class?
Yeah, I'm teaching a class in the Pellegrino Center, has Georgetown in cooperation with Catholic University America, a Master of Arts in Catholic healthcare ethics. And so right now I'm teaching a course in applied Catholic ethics, which is one of the more towards the end of the degree program. And so we've worked a lot on different issues in thinking about the church, from some of the readings of Vatican II to the encyclicals of John Paul II and writings of Pope Benedict. And then we've done 2 of the encyclicals of Pope Francis. So we did Fratelli Tutti last week, and this coming week we're doing Laudato Si, to get a sense that that ethics and healthcare is a ministry of the church, and that we need to look broadly at what it means for us to be church, how it is that the church speaks as a voice to the world today, and to think about what our responsibility as Catholic ethicists is to both dialogue, to sometimes confront, to always be willing to try and bring the healing message of the Lord into different settings, but to do that with a little bit of theological analysis and insight.
I just recently got to read and finish Fratelli Tutti. It's just a remarkable document. In some ways, it's more moving to me than Laudato Si, although Laudato Si really lays out a kind of theological vision of the human person, of creation, and our care for it.
I mean, I lectured the second-year students yesterday on professionalism, and after I went through it all, I took the quote about kindness from Fratelli Tutti, and I said, if you do all you can for the patient before you, and then you pay attention to this message about kindness, you got it done. You got it down. You're doing it great.
There's a wonderful line. I think that's ours in the Pope's newest book on after the COVID, where he says, "It's in our insufficiencies that we are united as brothers and sisters." In our insufficiencies, not our sufficiencies. And it made me stop in my tracks, because we always think, that it's in the things that we are alike in that unites us. But really, the Pope is asking us to think about the fact we all have insufficiencies. That's how we're actually on the same playing field. And it's a profound line. Yeah. We just have a couple more minutes, actually. And I always like to end, we have a few more questions I'm not going to probably get to, but I always like to end with a kind of what we used to call, the fervorino. As a Jesuit here at Georgetown, as somebody who has been a leader both in medicine as well as a leader of the spiritual life of the Jesuits as Provincial, we're in Lent, we're getting towards Easter. What's a good word? What's some advice you'd like to share with us, given the whole history of the last year, but really as a Jesuit priest in this time of Lent? What's a good word?
At first, it seems like it's been Lent since last February. And so that's one thing. As we move towards Easter, I am struck that, many of the resurrection encounters, they know who Jesus is because he shows them his wounds. And I think that there's a tendency to sort of say, oh, we got this COVID all over with, like, boom, let's go. We will move out of this pandemic. We will move out of the time of fear, but there are ways in which we will carry it with us, and that is part of the way that we're going to find the risen Christ in our lives. Yeah. There are some of the people who are listening to us, I'm sure, who've lost family members, people they love. We've all been through various kind of traumas with this pandemic. Mm-hmm. And I think that to allow time to find Christ again in a new life is going to be the biggest gift that we can have from Easter. Thomas Merton had stuff about sometimes like, you don't feel it Easter on Easter morning. We might not feel Easter this Easter morning, but to allow, did Hopkins say, let Easter in us or something like that?
Yeah. May Christ Easter in us. Yeah.
Yeah, and that's sort of what I think we have to. And that means, the important grace of the fourth week of Jesuit spirituality around the resurrection is not that there isn't pain, but that God is in that and brings something and brings life beyond the possibilities we could ever think of. Yeah. But we've been going through a long Paschal mystery, and I think we need to pay attention to that pain and see what God is bringing new life, both for us and as a church and as a world.
Yeah. Well said, and absolutely. And we've been sharing with folks on different venues, different media. This one, certainly the conversations, what we do in campus ministry, what we do with other alumni. It's just really a real joy to be able to do this with you, Myles, to have this conversation. And we really welcome you to this job. And I'm so glad that you're here. And there'll be a time, as you say, where we'll be able to be together with students and with our doctors, with our medical faculty. And I really just appreciate your time with us today.
Thank you so much, Mark. And it's wonderful to be here. And thanks to all the folks who listened today. Sorry about my wardrobe malfunction.
It's part of COVID. Don't worry. Well, thanks everyone for joining us. And remember, we'll have another one coming up March 31st, I think, in which we're going to talk about Flannery O'Connor in the film, and Father Michael Garanzini will be with us, as well as my co-producer, co-director, Elizabeth Kaufman. So please join us for that. Right now, we'll just say God bless you all. And as we say in Italian, ciao, ciao.